Dominik, thanks so much for taking the time today.
Hey, Mark, thank you very much for having me. It's a pleasure.
Well, listen, I'm looking forward to diving into oral health here and the impacts on athletic performance and health, because I think it's an area that's obviously a lot of people don't fully appreciate on first glance. But before we do that, maybe you can give folks a little bit of a more background on yourself and your journey to where you're at today.
Oh, sure thing. My name is Dr. Dom, and I'm 37 years old. I'm a specialist in biological dentistry, so I'm trained as a dentist and a naturopathic doctor, functional medicine doctor at the same time. I basically got interested in performance and health optimization 20 years ago. I was very athletic as a kid, trying to become a skateboard professional, but I was always like kind of a little bit of sick and chronic tonsillitis, appendicitis, a lot of things that just threw me off, and I didn't make it as a professional skater. So yeah, from there on, I was just optimizing my health, studying and dentistry, but mainly it was more focused on performance and athleticism for me personally, maybe also from a vanity standpoint or like, yeah, aesthetics. I wanted to become muscular, jump higher for skateboarding. Probably the same thing a lot of guys within their early 20s try to.
Yeah, sounds familiar.
Yeah. And yeah, so basically I got into contact with nutrition and supplements actually while I was at civil service when I was about, 20 years old. And I did all these things right parallel to university kind of. Of course, you have to study medicine in university as a dentist, and you learn all the things about biochemistry. And while I was doing at the same time everything with nutrition and supplements, this kind of like work, but I didn't know just yet that I will use this later on for my patients. So I just basically went to university because I had to do anything anyways.
Nice.
I'm pretty skilled with my hands. My dad is actually a dentist too, but actually I didn't want to become a dentist like for the first 20 years. Like I said, only wanted to become a professional athlete. And I thought maybe working just sucks because my dad was basically always at work. So I
Mm-hmm.
couldn't figure it out. But of course, I was good with my hands, and I just jumped right into university, started dentistry because I thought, okay, I'm good with aesthetics, I'm good with my hands. Let's just see. Didn't know that I had to study chemistry, biochemistry, and all these things. But because I was doing all these things parallel for me and my performance and just for optimizing my chronic problems, it kind of clicked, but it took me quite a while. And after graduating, actually, I still didn't know that dentistry would be the perfect thing because besides the high tech craftsman, everything craftsmanship, something was just missing. And after university, I have to do assistancy at a doctor for about 2 years, or residency, it's called.
Mm-hmm.
And I had the chance to work with a very skilled surgeon. Always wanted to become a surgeon. I don't know why, but this kind of seemed challenging to me to, just do surgeries, oral surgery. And he was doing amalgam fillings. And amalgam fillings are these nasty, ugly black fillings. And I told him straight away, sorry, dude, I cannot do amalgam fillings. I will go with the white ones, the ceramics, etc. And this was basically when everything clicked together because I had to tell him why I wanted it. I knew from my dad that amalgam is kind of toxic. In university, I only learned that it's an easy to work with material, will last forever, and only kids and pregnant women shouldn't use it.
Mm-hmm.
That was what the perspective from university. But I knew my dad wasn't using it for at least 20 years, and I just thought it's just ugly. So I looked it up, and initially on YouTube, I found Dr. Dietrich Klinger, Joachim Mutterk, and very specialized functional medicine, integrative medical doctors who were dealing with amalgam and heavy metal toxicity for the last 30 years. And it was basically supplements, nutrition, biochemistry. And this is when everything that I learned for me personally for 10 years clicked.
Absolutely. And that's terrific, Dom. And if we maybe start on the nutrition side of things, we both share a deep appreciation for the work of Weston A. Price,
Yes.
renowned dentist, actually a Canadian dentist at that, and his prominent work in the 1920s and 30s, going around the world to various cultures and in examining the dental health of these indigenous populations who are very isolated. You talk about this in your book. Could you share with listeners some of the observations that Price made and how that impacted you in your philosophy and practice?
Yeah, actually, I stumbled over Weston Price from a different point of view or a different topic because he's also very well known as one of the first biological dentists. He back then he was seeing problems with the root canals that just came up, and he actually did some epic studies, and he extracted. So he told all his patients with chronic problems, I'm suspecting the root canal tooth. I don't know why, but maybe infectious. Just let it remove. And then he implanted these root canal treated teeth under rabbit skin. He basically probably did this for 30 years with a huge team over probably 2,000 or more cases, where he just found out that the rabbit would develop the same chronic diseases as the human donor of the root canal tooth. With heart disease, it was 100% the same, and about 80% of all other symptoms just transferred by transferring the root canal tooth from the mouth of the patient into these rabbits. This was the one thing I stumbled across, because in biological dentistry, root canals are viewed differently, where you can go into this deeper. And of course, the other part was me personally being super interested in nutrition. And this guy, Dr. Weston Price, also, and if you see, 100 years ago, it was kind of a stretch to travel to indigenous people. Like, he went from the US, probably with the ship, to Australia, and he checked the Aborigines. He went to Africa and also to Switzerland, and just he went to more rural areas and wanted to see, in his book, it's called Nutrition and Physical Degeneration, he wanted to see how diet impacts oral health, but also the whole body structure and posture. And he was just checking for indigenous people that still would eat a more traditional diet, and possibly their grandchildren were already eating like the industrial stuff, like sugars, grains, refined products, like maybe vegetable oils, and all the stuff that came up in the industrialized area. And what he found out was that, like, traditionally eaten diets would lead to perfect, healthy jaw, like very wide jaw lines, all teeth in line, no crowding problems, all wisdom teeth in line, very wide space and big nostrils, no scoliosis, like super posture. But if they already got into contact with, let's say, sugar or wheat and processed food, they totally look deformed, kind of like Frankenstein. The teeth were coming out of their eyes, if you know what I mean.
For sure.
But if you see the pictures, it really looks crazy. So way more narrow faces, no space for teeth. Like, kind of the same problems we have in the Western countries, like in Germany or London, where you're in UK or US. Almost, I would say, at least 80% of all people get their wisdom teeth removed because of problems with no space.
Yeah, it's amazing how these modern nutritional practices, it's a pretty profound impact when it's literally changing jaw structure and teeth alignment and things like that. And, this really dovetails into how I like to anchor today's discussion, which is around, your passion for performance and, of course, athletes and performance. And there was a great study done a few years ago around oral health and the impact of performance on athletes who were participating in the London Olympic Games in 2012. Which is pretty fascinating. They looked at over 300 athletes from Africa, the Americas, Europe, and the results were pretty interesting. I think you'll appreciate this. The high levels of poor oral health, including, I'll list a few off here for you, 55% of athletes had dental caries, 45% dental erosions, 76% gingivitis, more than 40% were bothered by their oral health, 28% actually reported that it impacted on their quality of life, and 18% actually reported, so nearly a fifth, that it impacted their training and performance. And so, if we maybe start with dental caries, some of the things that I think about when it comes to fueling athletes is just the meal frequency, so having to fuel them so often, 5, 6, 7, 8 meals in a day, but also that sugar side that we talked about, the simple sugars. So, what are your thoughts on those things, or maybe other potential areas that are causing those kind of issues in athletes?
What are causing this? So first of all, like you already touched on, it's nutrition, and it's not just the sugar, which is like the fairy tale that everybody listens to as a kid, that these bacteria in your mouth will use the sugar and then drill holes in your teeth and you get cavities. It's a little bit more complicated, but of course, kind of like sugar is a big part because, recurrent insulin spikes, like glucose variability plays a big role. The whole saliva is depending on your whole nutritional side of you, like if you're lacking amino acids, proteins, and lots of minerals. So first of all, maybe if you could do a top-down strategy, the most critical nutrient, in my opinion, for overall health and building is, of course, protein, amino acids. Same goes for teeth and for saliva. But for teeth are kind of like, you could imagine those as, big crystals, basically. They are hard as stone, hard as granite, actually. But teeth are as, they can feel things like a tiny hair. So it's literally a crazy organ. Mm-hmm. And these teeth grow from the inside, but also get remineralized from the outside. So if you're having a lack of minerals, for example, and in terms of minerals, we know that vitamin D3 is pretty crucial to help you get minerals into your system and then transport or delegate them to teeth and bone. Vitamin D3 is a crucial part, which most of the people are lacking, in my opinion. And of course, the stuff you already probably test for your athletes, and everybody should, is the intracellular minerals like magnesium and zinc, which play a big role. And the saliva, if it's depleted because you don't eat minerals, because your diet is lacking of it, of course you cannot remineralize teeth. And basically, the dentist coming from a reparation or maintenance, like a garage point of view, like just the teeth are basically just for biting. They don't see teeth as organs, but every single tooth has a blood supply, has a lymph supply, an autonomic nervous system, even a parasympathetic. It's connected to your vagal nerves, and you have to see that they are alive, and you cannot just drill on them. So if I see let's see an athlete, everybody with cavities, I always suspect or look further. Why is this person having cavities? And initially, is this cavity even big? Because tiny cavities, like we call it initial cavities, you can totally remineralize, but then you have to look at the overall picture where, again, the frame comes in and health starts in your mouth. But this is where the conventional dentist is just not trained. So the whole nutrition side of you, and I've developed a food design concept, which is basically eat the stuff that builds your body, like what you can hunt, what you can find, what you can fish, like as natural as possible. Of course, we cut out all grains and sugars and highly refined omega-3s and you name it, so that we provide the body with his building blocks first, so that not just the teeth can regenerate themselves, but also every other tissue.
And Doc, that kind of leads me on a couple of questions around, if we look at, a couple of questions I get from athletes. One of them is around brushing their teeth. So you mentioned, obviously sugar alone is not the whole story, but, if athletes are consuming 5, 6, 7, 8 meals a day, if they're only brushing twice a day, is that sufficient? If they do have that level of nutrition, that's going to help to offset, or would somebody consuming that much food need to be able to increase that type of, brushing?
So in my opinion, if the nutritional design or food design, how I would call it, is accordingly, so I don't think that athletes probably eat 6 times just sugars and carbohydrates all the time. So if your food, let's assume your food is perfect, in my opinion, it's totally enough to brush once a day. And maybe start with something like oil pulling, tongue scraping in the morning, and maybe brushing in the evening. So I only brush once a day, and it's totally fine. So, but I have to add a but. My diet is in check. So I don't eat anything that causes this kind of fur on your teeth. You know what I mean? If you Coke, a Coca-Cola, initially, like 2 minutes later, you have this tiny fur on your teeth. Or if you eat just a wheat bread or something, you know what I mean?
Oh yeah, I mean, it's sort of the opposite of that experience when you do go to the dentist. After you've had a cleaning, your teeth just feel like they're completely smooth and
Maybe you remember if you eat something that's starchy, within seconds you have this so-called biofilm on your teeth, and it feels like sticky and a little bit, not clean. My teeth feel clean the whole day because what I'm eating is what I'm supposed to eat. So basically, I time my macronutrients according to when I need them. So basically, what most people should do, or if they do, is like eating protein within every meal. It's at least what I would do, and healthy fats, and train your body to become metabolic flexible so that you can actually work with the fats. And carbohydrates, I would probably time those. But of course, depending on your athletes, I don't know how they all eat. If they, of course, drink sugary drinks all the time and like 400 grams of fizzy drinks, then you probably need to brush a little bit more. But basically, if you eat a good diet and a nutritious diet, then your body is able to rebalance like the pH and everything within 15-20 minutes after a meal. The pH level will be restored because you don't have any too much fluctuations. So necessarily you don't need to brush all the time. But of course, if you only eat sugars and starchy carbohydrates, stuff that really sticks onto your teeth, you might need to brush 2 or 3 times a day.
Yeah, I mean, that's good to know because obviously at the tip of the spear in some of the, particularly in endurance sport and even in various professional sports, whether it's basketball or even football, the demand of carbohydrate can be pretty high. So even if it's not from sugar, then a lot of the starchy carbohydrates will be in there. So good to know around the nuances there with that. And if we look at that 76% of athletes having gingivitis, now is that just an extension of what you talked about around dental caries, or is there something else going on with the gingivitis?
Yeah, gingivitis is a chronic inflammation of your gum tissue, and kind of like your gum tissue is outside body, like your skin or maybe your enterocytes in your intestines. So you want your gum to be as healthy as possible. There shouldn't be any little bleeding, any gingivitis. So again, there's multifactorial. Yes, we have to see. To go from, like, if you have nothing dentally done, let's say you have the perfect teeth, you're just cleaning them, go to an oral hygienist twice a year, like all professional athletes should have. You don't have,
but don't, unfortunately.
Yeah, but if you have this, then your oral microbiome is normally perfect. So we have a few anaerobics, a few aerobics, you have a few parasites, maybe some viruses, some fungi, but they're all in a nice environment without activating the immune system too much. But if you have ever seen a dentist and have some reparation work done, you might end up having a metal filling. Let's say, for example, an amalgam filling, which is containing 50% of mercury and is just highly toxic. Or you have a root canal treated tooth because you had a huge cavity, you had massive pain, and the doctor had to help you with the pain and just doing a root canal treatment to get rid of the pain and leave the tooth as a dead organ for biting. Or you have various other things in your mouth, like a titanium implant, different metals. You have, if you look at from the mechanical point of view, everything you put in your mouth, like in this case, we talk about oral interference, like metals, root canals, these so-called cavitations, also just braces and stuff, will disrupt your microbiome and will lead to more inflammation due to, let's say, toxins that leach out of the metals, because the saliva is the perfect electrolyte. Every metal in a watery solution will corrode. That's just basic physics, kind of like the propeller of a motorboat underneath the water. You know how that looks like after a few it's rusted. The same happens with metals in your mouth. So this is just one part. So you always have to take into account the toxicity of materials from a biological point of view, but also the immune system. And if you have any kind of chronic inflammation on your gum tissue, then it's mostly because your immune system is in a more aggressive mode, a little bit out of control. So your innate immune system will just use the macrophages and activates them through cytokines like TNF-alpha, interleukin-1 beta, IL-6, like these pro-inflammatory cytokines, and then you will end up having gingivitis, just maybe by having the wrong materials, but also again by having just stress, oxidative stress, lack of nutrients. So gingiva, just the gum tissue, it's collagen. You need vitamin C. There's this disease called scurvy. Scurvy was this fisherman's disease when they were on and didn't have access to vitamin C. And it's really not a lot of vitamin C you need a day. I think it's only about, don't let me lie on this, but let's say 40 milligrams a day you need to prevent scurvy. So it's literally nothing, but still they had too less. So collagenases wouldn't work and they would just lose their teeth. And this initially starts with gingivitis. So it's more like an outside view, but gingivitis is the same as an inflammation in your enterocytes or leaky gut over time. Leaky gut, it's a well-known term. I'm 100% sure you know what that is. If you have gingivitis, it's kind of like leaky gum already starting in your mouth, because gum is outside body. If it gets to the bone, it's inside body. So you have the perfect Niagara Falls then for all these oral microbiomes to go inside your tissue, in your periodontium, in your bone, and then it gets periodontitis, or maybe like more anaerobic bacteria will live it. They like it without oxygen, of course.
And Doc, obviously with the multifactorial condition like that, it's complex, and there's numerous root causes, and some of which are going to take, more of a longer term plan to start to address, especially when they involve things like lifestyle. But if we, with obviously 3/4 of athletes struggling with that, is there a certain, what are some simple or foundational pieces that would be great strategies for people to start with, or athletes to start with, to help to reverse that?
Yeah. So if we start with just the focus on oral health, I would just start by removing every fluoride toothpaste and use a more natural one, maybe on a coconut base, and clean your teeth. Let's say for starters twice a day, that's fine. Use something called oil pulling in the morning. You just use let's say an extra virgin coconut oil. You can add some essential oils with it, like oregano, for example, and then just oil pull. That means you just take a tablespoon of this coconut oil and just swish it around in your mouth for 5 minutes at least, gently, and then spit it out. You could start with this every morning, and your oral microbiome will profit. You have to see all these little tiny bacterias and microbes that live with you in your oral cavity are very, very important. They help your immune system, they help your digestion, but you want them not in the dysbiosis, you want them like as healthy as possible. This would be an easy strategy. You could also add some Ayurvedic herbs, and tongue scraping would be another good thing to do, just from an oral perspective. I'm not a big fan of flossing. This actually depends again on if you had a lot of dental work done. If you had any metal restorations or any bigger restorations, you probably need to floss, because otherwise food gets stuck. But from a more natural point of view, if everything is healthy in nature, you wouldn't use any flosses. You maybe would use a stick if something sticks in between, but normally the gum is in between your teeth. There is no hole in there, and most people are not perfectly trained to use flosses, and they will just like smack it down in between the teeth and then always bleed. You understand? They bleed. What do you do then? It's again leaky gum. Think of leaky gut. You're opening the tissue for all the microbes. So this would be just the oral easy tool. Twice a day brushing, use a fluoride-free toothpaste, do the oil pulling, use extra virgin coconut oil, and maybe some essential oils. But the lifestyle that you talked about is actually as important or even more important. And what we always do, you can look up the food design in the book and everything, but basically feed yourself as natural as possible and stay away from at least all the major inflammatory foods. Already mentioned them, but again, stay away, of course, from sugars, from, I would say, all grains, basically, at least the refined ones, and depends on your tolerance. Stay away from vegetable oils, like these highly refined omega-6 oils, for example, sunflower, safflower, you know what I mean? Like these plastic,
absolutely,
the plastic bottles with the yellow stuff in it.
Yeah.
And it's saying refined or triple refined. that's extremely inflammatory. And of course, it's extremely inflammatory for all tissues, and of course also for your gum tissue, your teeth, your tongue, for everything. Stay away from this. And I would also recommend staying away from dairy. It's also just, it's of course a personal thing for me too, but I've seen so many patients struggling with dairy in terms of immune system overactivation. So I had chronic tonsillitis. They actually wanted to pull out my tonsils when I was 16, and luckily they didn't do this because I found a naturopath who just told me, you're allergic to milk, just leave that away. And actually my tonsils are still in there. It's fine. But if you have any sort of like mucus overproduction, and you have like maybe clogged ears, or maybe you cannot breathe through your nose, kind of like these low grade silent inflammatory signs, skip the dairy. So that would be the first easy things. And then we have a green and a red chart. So the macronutrients in the soup, and we call it superfoods. Red is basically avoid the food intolerances and food toxins, and there are some, of course, a lot of alternatives. And green chart is superfoods, and it's designed in macronutrients, protein, healthy fat, healthy carbohydrates, vegetables, and fruit. And then you can time those. That's what I call macronutrient timing or micronutrient tuning. So at least get your protein intake. And I would say I'm according with you on this, and I've read your book, of course. And I would say I always recommend, at least after surgery or when it's for healing and for athletes which are very demanding, 1.5 to 2 grams per kilograms of body weight. So I would recommend in these sorts of scenarios, depends on chronic diseases or not. Initially, I don't care if it's plant-based or if it's animal-based, but you have to know how you use all these things, and healthy fats for your cell membranes, for your neurotransmitters, for your skin, of course, for your tissue and your gum. And then I'm very big on carbohydrates. It's more like we time those. I would say you probably time them differently for athletes, and probably they will need way more, like you said before, if they're doing basketball or a little more endurance stuff. But it's probably the timing. Most patients I see don't need too many carbohydrates. Of course, I have a lot of athletes, they will and they do. But a lot of the chronic sick patients, maybe also cancer patients, I will probably actually go on a ketogenic or maybe more paleo-ish type of diet. Just go as ancestral as possible, leave out the processed stuff, and you're pretty good already.
And Dominik, on that side of saliva, I mean, salivary IgA, obviously providing a huge immune protection, and the salivary flow rate is obviously important for keeping athletes' immune status up and preventing, infection. Can you talk a little bit about that role again? You've touched on it here, but that role of saliva in good oral health and some of the different functions it has on that immune side?
Yes, saliva is very important, not just to remineralize the teeth, but this is, of course, one major fact. It also protects the tooth from the outside against bacteria, and it contains a whole immune system, like you already touched on with the IgA. It contains mucins, proteases, it contains peptides, which are anti-inflammatory but also anti-infectious. So it's very important. And the flow rate. So if you're getting a dry mouth, everybody knows if you're in fight and flight or in stress, you probably, like an athlete knows this. If he's going into a battle, like a competition mode, he will have dry mouth syndrome. That's just normal because your sympathetic nervous system will block saliva production, because saliva is basically also there to help you digest foods. There are these enzymes, amylases, proteases. Basically, your whole food is already pre-digested. So if you're in a chronic stress state because you're overdoing it, for example, as an athlete, you probably have a lower saliva rate, which also in secondary will affect the tooth health, because you're getting not enough minerals. You probably end up having a dry socket, a dry mouth, and maybe not as good gum health, maybe a little bit more gingivitis, and of course a poorer immune system then. And this is basically then a sign of chronic stress. Does it make sense?
Oh, absolutely. I think it's such an overlooked area, and I think that's one where we get a lot of dovetailing with a lot of the research around salivary IgA flow rates and immunity. And I think that's a great opportunity for practitioners to start to be able to put some things into place to support that. And do you have any strategies to whether it's supporting saliva or bitters or supplements that you go to in that sense?
Yeah, bitters, I wanted to mention bitters. Yes, actually, I'm a big fan of bitters and digestive enzymes. So digestive enzymes help a lot, and bitters. And if you really have a problem with saliva production, chewing xylitol gum will actually help here. Xylitol is a birch sugar,
Mm-hmm.
which actually is antibacterial in itself too. So chewing the gum will help with the saliva production, and the xylitol kills bacteria because bacteria think it's sugar, they will eat it, but they don't tolerate it, so they blow up. That's why a xylitol gum is not a bad strategy in itself. Of course, drink fluids. The water is very important. So water is a foundational thing we didn't even touch on, but water, of course, you need to drink enough water to get enough fluids, and water in itself, we could go down this rabbit hole, but make sure it's a clean source, that it contains all the minerals. If you can, tap water isn't emphasized. I would basically, if I find something like artesian water is probably the best, and it should come from a glass bottle. I'm having a filter system in my home and in my clinic, and remineralize the water with stuff like Quintone water. Maybe you've heard of this, Quintone. It's cube, and this is basically like our inside isotonic or even hypertonic state is. That's something I would really recommend for athletes, focusing on the mineral intake by adding stuff like this to their water, but also on a high quality magnesium supplement. And of course, supplement wise, I've developed, so I'm a big fan of food first, like I already said, but if I know that the diet and nutrition part is correct, I will of course check micronutrients. And a critical one is vitamin D3 status. So all my patients, because I'm doing big time surgeries in a health optimization week, all in one always, are prepared with high doses of vitamin D3. That's 20,000 IUs a day, which is around about 1.5 hours in the sunlight. And you cannot just give high doses of vitamin D3. So in the whole bone healing protocol, you have all cofactors, all the activated B vitamins. You have vitamin K2 as a critical cofactor, and magnesium is a big one as a cofactor, because vitamin D3 is basically bringing calcium ions back. And you don't want to have these calcium in your blood vessels. You want to have calcium then transported to the bone and the teeth. So basically, teeth and bone regenerate themselves the same way. You need two enzymes that get activated, is osteocalcin and MGP. And vitamin K2 basically drives these enzymes kind of like a truck and brings the bricks, which are calcium, together with the co-pilot, which is magnesium, into the teeth, into the bone.
Absolutely, Doc. And I want to respect your time here. So if we shift gears to talking just aesthetics, a lot of clients and athletes are big coffee lovers, myself included. And so the conversation around even whitening of the teeth is a common one. Now, is this something where when people go to their dentist, is this a fine practice to do whitening teeth, or is there an alternative to that? Are there any negative repercussions? What are your thoughts there?
So I don't see any big problem. So it's fine to have a little bit of vanity and aesthetics. So everything I did started with aesthetics. Of course, we also have a clinic for health and aesthetics, and you can totally do a bleaching. I would recommend being prepared with your nutrition so that you don't have any lack, because these whitenings, they tend to make your teeth a little bit more sensitive for 2 or 3 days, because it's just they dry out a little bit. So the better you prepared with minerals and amino acids and vitamin D3 and omega-3s before vitamin C, the less problems you have with these sorts of procedures. And I think it's not a big deal. I would actually do this with a specialist, and don't buy any whitening toothpaste or whitening strips or do DIY it at home, because its potential downside is, for example, that they have too much of abrasives in the toothpaste, and then you actually polish off the very best thing, which is your healthy enamel. So I would rather go to a specialist, do an in-office bleaching, or let me do a splint for you, and you can have a splint at home and bleach home-wise for 2 weeks, and then you have the color that you want, and you have the splint. You can do it again every 3-6 months for a night or so, and you have your white teeth. If you have generally just want to do a little bit of a whitening. So I think that's totally fine. I'm not a big fan of doing veneers and stuff without considering function of the bite first. So aesthetics in terms of oral aesthetics, so basically every aesthetic follows function. The same goes for the mouth. So we didn't touch the bite. The bite is the forgotten interference field, because basically the bite is the thermostat for your whole posture. And if you had lots of dental work done, or you're grinding and your teeth are a little bit worn down, you're losing bite height. And if you then, and of course your front teeth will get shorter, and that doesn't look so good. So a lot of people will then just place veneers on top, but then it won't work, because that's partly in the front, and
Nice.
and in the back it's crap. So you have to look at the overall picture and rebuild the whole system. And also you can look, maybe you have crowded lower teeth like I have. I don't even care about this. I like the aesthetics if it's a little bit more individual, but I can see that people want to have like total straight teeth. I would always first think about maybe doing orthodontics. There are nowadays splints available, like the Invisalign concept, where you just apply a little bit of a splint of like a sequence of splints that have informations in them to where your teeth should be in the future.
Mm-hmm.
If you combine orthodontics with the full body approach, that means supplying the right nutrients again, macronutrients, micronutrients, and then go to an osteopath and do structural or manual work, like for your fascia and stuff, at the same time while doing orthodontics, you are able to reduce orthodontics sometimes to 3 to 6 months, whereas normally lasting 1 to 2 years. So you just again stack these techniques together and help your body just build that stuff faster. And then if everything if all these things, if you have done all these things and you need a little bit of a veneer because the one tooth is just too crowded and you can work additionally, you could use non-prep veneers. This is something that highly skilled aesthetic dentists are able to do. That means you don't even drill the tooth. You just add something on top to it to make shape or make the shape more nicely or evenly. So first of all, function, and then you can work on aesthetics afterwards. But the basis of everything we do is health, optimal health. And this is why we always take focus on first things first. That means if it's a house project, we will first start with the basement, which is removing the crap from your mouth that's been installed over the years. Like I said, metals, root canals, cavitations. Restore the bite, of course. And if this is all stable, of course, we will do perfect aesthetics. This is just something that goes hand in hand and has to come with it. But it's just a side effect of the whole concept. And health, aesthetic always follows health, I reckon. So I had to learn about overall health in my journey, starting by aesthetics. And yeah, that's why I learned all these things, getting me healthy. And if I think everybody out there is interested in optimal health, and this, yeah, you have to start at least look into your mouth if you're chronically tired or just having inflammatory statuses, having insulin resistance. Also, it's all correlated with chronic silent inflammation. And of course, if you're having problems there, check your mouth.
Amazing, Doc. Well, listen, this has been fantastic. Oral health, obviously an important element for human health, overall health. And as we've seen in some of this latest evidence-based research around athletes, required to really optimize athletic performance. So appreciate you taking the time. Your book, fantastic read. It's all in your mouth. Where can people pick up the book? Where can people stay connected with you and all your terrific research and work?
Yeah, you can find me, of course, on our website. You probably put it on the show notes. It's Aesthetics, and I'm having an Instagram where I put out a lot of content about functional medicine and, of course, the health starts in your mouth concepts. I'm at Dr. DRDOME1, Dr. Dom1. I have a YouTube channel, Dr. Dominik Nischwitz. And basically, if you Google this name, you will probably find a lot from a dental point of view for the experts in this field. But also, I'm working on a lot of information for the general population. And the book, which you have already mentioned, is called It's All in Your Mouth. And it's actually written for the layman so that everybody is able to get this information, and it's easily digestible. But it's also good for the experts because not all dentists know all these things that I've learned over the years.